Welcome everyone to the program from National Single Payer about the Dunn County Referendum on National Health Insurance. My name is Kay Tillow. I'm chair of Kentuckians for Single Payer Healthcare. I'm with Unions for Single Payer, and I'm with National Single Payer. And National Single Payer is the group that is bringing you this program. National Single Payer is dedicated to focusing on the building of a movement powerful enough to make what is right for the country also politically possible and pass full, nonprofit, publicly funded national single payer for everyone and with no payment at the point of service. That's our mission, and we believe that that is indeed supported by a majority of people in the country, which indeed has been proven by our friends in Dunn County most recently. Tonight's program is featuring two people who are elected county officials from Dunn County, Monica Barrier and John Calabrese, both of whom had a lot to do with this. And I would like to invite everyone here, if you want to help to push forward National Single Payer and the program of mobilizing our country to pass that, we encourage you to make a donation, and that link is in the chat during this program. That will help us to make the work to go forward. Tonight's Zoom technology is being handled by the amazing Dr. Anna Malino of San Francisco, and the chat and questions are being monitored by Dr. Judy Albert of Pittsburgh, who will then, after the speakers finish, lead the question and answer session. Each of the speakers will take approximately 20 minutes, followed by the Q&A. So I think we should go ahead and get started. You're invited to put your questions in the chat at any time, and Judy will find some way to pick those up and to sort through them and to ask the questions. Our first speaker is Monica Barrier. In addition to being an elected board supervisor for Dunn County, she is also an adjunct professor of philosophy and a volunteer organizer with Our Wisconsin Revolution. And our second speaker is John Calabrese. He's a woodworker, a member of the Dunn County Board of Supervisors, and a chapter development lead organizer with Our Wisconsin Revolution. We're so honored to have the two of them with us, and I'm going to turn the floor over to Monica.
All right. Thank you, Kay, for your introduction. And also thank you to National Single Payer for hosting this event and helping us get the word out about what we did. So we're really excited to be here tonight, even though we've already done the work of successfully passing this referendum. We really see that our work has just begun here. We see our work as like igniting a spark, and we want to provide people in other areas with the inspiration and also the tools that they need to keep this fire going, right? To pass referendums like this themselves so that we can keep things going. So our goal tonight is to talk about what we did in Dunn County from the very beginning of our process all the way up to what we're doing right now in order to give people a roadmap so that they can take this and get something going in their own county as well. So the way that we'll organize this is I'll begin by explaining how we went about writing our referendum initially and the considerations that we had for writing it. Then we'll talk about how we took our referendum to the county board in order to get it onto the ballot in the first place. Then John is going to take over at that point to talk about strategies that we used. We took the referendum question to the people to get them to vote for it. And then close with some ideas about how to keep the momentum of this movement going in your own areas. So to begin, I should give you guys some background about Dunn County and sort of the political climate of what's going on here, because it's important to understand for how our approach and how we worded this referendum. So first of all, Dunn County is a poor rural county in western Wisconsin, and it's conservative here. This is Trump country. The county went to Trump in both 2016 and 2020. Poverty, so the biggest employer in Dunn County is the Walmart distribution center and the Walmart supercenter. So not very high quality, high paying jobs with great benefits, right? As you can imagine. A lot of other people in our county will work 2 or more part-time jobs to make ends meet. Again, not a great situation for health insurance, right? They're not getting their employer provided health insurance. And then also there are a lot of farmers in our area, right? People who aren't getting insurance through their employer, so they're having to go to the exchange. And we all know that that's also not a great situation for people to access care. So like everywhere in the country, we've got a problem, right? About health insurance and how to access healthcare. So we had this hypothesis when we were talking about this. We had this hypothesis, like, is there a way for us to frame this question about national health insurance in a way that's going to appeal to the conservative voters, right, that we have here in Dunn County? Traditionally, we know that this health insurance problem has been seen as something more left-leaning, more progressive. But we thought that if we could find a way to sort of talk to people in terms of their own bottom line, and their ability to pay for healthcare and access it, that maybe this would become more appealing to conservative voters. So that was kind of the impetus behind what we were doing, the motivation behind our project. So with all that in mind, with all that background information in mind, I want to turn next then to sort of the first step in what we were doing, the first problem that we had to solve. Which was the problem of writing the referendum itself. So I'll go ahead and read this, and then I want to talk about the different parts of it. And there's some parts that I know are going to be surprising to this audience, and we'll talk about that. So the referendum that we proposed and that we passed was, shall Congress and the President of the United States enact into law the creation of a publicly financed, nonprofit, national health insurance program that would fully cover medical care costs for all Americans. All right, so this is what we did, and this was what was successful in our county. This passed 51 to 49, which doesn't sound great at first, right? But you got to remember, again, that this is Trump country. It outperformed the leading Democrat candidates on the ballots by 8 percentage points. So we indeed did have a lot of conservatives voting, people who voted evidently both for Ron Johnson, if you're familiar with that race, people voting both for Ron Johnson and this referendum at the same time, which is really amazing. All right, so how did we find a way to appeal to these conservative voters in Dunn County? All right, first thing is that we worked hard to avoid buzzwords, right? We know from political polling that buzzwords like Medicare for all, single payer, these do not resonate very well with conservative voters. We know that the way that you present progressive policies really makes a difference behind whether somebody's gonna wanna get behind it or not. So instead of talking about Medicare for all and single payer, we just described the program that we were after. Let's see here. The other surprising thing that I'm sure a lot of people on this call have noticed is this stuff that we've talked about, providing medical care costs for all Americans specifically, right? That's an uncomfortable point for a lot of people. I personally believe that a single payer program should cover costs for everybody, right? That's my personal view. But we're not talking about writing a referendum for Monica Barrier and people like Monica Barrier, right? We wanted to write a referendum that we thought that people in Dunn County, Wisconsin, the conservative voters here, would be able to get behind, right? So it was a strategic move on our part. You know, to be frank, like, we're in Trump country, and to be frank, I think that if we had written a referendum about all people, right, or everyone, I don't think it would have passed, right? There's a lot of rhetoric of a certain type, right, in our county about immigration. There's also a lot of rhetoric of a certain kind about government programs and who should be able to access them and who shouldn't, right? And we didn't want any of those problems to make it into our conversation about national health insurance, right? We thought that it would be poisonous given the political climate that we're dealing with here in Dunn County. Yeah, so for every government program, of course, there's two questions, right? The first question is like, what are the merits of the program? And then the second question is, who should access this, right? These are two separate questions, and we really wanted to keep these two things separate in our conversation about health insurance. So that was why we did that. Now, that's bringing the issue back to you guys, right? Anybody here who's thinking about bringing this to your county and trying to get a referendum going there. It's important for you guys to be sensitive, right, to the political climate of wherever you are, right? What we did was a move that worked for us in Trump country. In a more conservative area, right, it might not make sense to do what we did. So you've got to be sensitive, right, to the people that you're trying to appeal to, and create a referendum that you think is going to pass, right? You don't want to do a referendum that's going to fail. That's worse than doing nothing. So be careful about writing a referendum that you think your voters are going to be able to get behind. So you got to keep in mind the voters. You also need to keep in mind the elected officials who are going to be approving your referendum, right? You got to make the case to them. And again, you got to be sensitive to creating wording that they're going to be able to get behind, right? If they don't want to put that referendum on the ballot, you're stuck, right? So you got to think about the people who are on your city council or county board, right? Whoever's going to be responsible for getting this on the ballot, you got to be thinking about them. So this brings me to my next point. Anna, can you advance that slide for me? So the next step after we figured out the wording of the referendum, the next challenge that we had to face was getting this thing on the ballot, right? And so the way this works is you have to petition your local government officials to get it on the ballot. And I think that probably works, right, differently depending on where you are. So I can't really speak to you guys, but for us, we were a step ahead on this problem because one of our members, right, John Calabrese, who's on this call, has been on the county board for 6 years, right? So he was really able to provide insight about the process that we would have to follow in order to get this thing on the ballot. So that was really helpful. In our particular case in Dunn County, the way that this works is we needed to bring this to the Dunn County Board of Supervisors, which in our case is an elected board of 29 people, right? It's very, very large. And so because it's so large, everything goes through a series of subcommittees before it gets to the full board, right? So we knew from John where we needed to start, which subcommittee we needed to start with, and knew the process that it would take. So we started our process by going to the executive committee of the county board. It's a subcommittee of maybe 8 people or so. And what we did was we had one of our members petition this subcommittee in her public comments. So this was Dr. Lorene Vetter. She's a retired physician in our area, also a member of PNHP and our Wisconsin Revolution. She showed up at the public comments at one of these meetings and laid out background about national health insurance, the benefits of it, and said, look, the time has come. We would like to see some change happening, and we would really like it if you could put this referendum on the ballot and let people speak on this issue. And we were really lucky because at that particular meeting, the chair of the committee that would be the next step, he was there, and he is sympathetic, like his own political leanings are sympathetic to this. So he said right there, like, great, we will go ahead and put this on the agenda for the next legislative committee meeting, which is going to be it was about 2 weeks later. So that already happened so much faster than we were expecting. We weren't expecting this to go so quickly, but 2 weeks later we had it in front of the legislative committee. So we were done with the first hurdle. The next hurdle then was getting it through the legislative committee. And we knew that this was going to be tough. And this is where the most important stuff that I have to say tonight about appealing to your elected officials. These are the most important lessons I think that I have to share. We knew that this was going to be a tough sell for the legislative committee. It was a committee of about 10 people. We knew going into this that there were people on the committee who were, although they were sympathetic to the idea of single payer, they were reluctant to put it on the agenda because they thought that this wasn't county business, right? They didn't want to feel like we were meddling in national business, right? We're here to do county business. We're here to do county roads and take care of the sewers and run the jail, right? We're not here to meddle in national issues, right, like this, and partisan issues. We want to stay out of partisan politics, right? So we knew that there was going to be resistance among the county board members that would have to vote on this from that perspective. So it was good that we knew this, because we knew that our job was going to be to try to convince them that this is county business, that this is something that you guys as county supervisors need to get behind because it matters to us here in our local government. So how did we do this? Well, first of all, in public comments at the beginning of the meeting, we had around 12 activists showed up to give their testimony about single payer healthcare, right? And what this would mean for them. They talked about, they gave the usual sort of arguments about single payer that you would expect, right? They talked about their personal experiences and this, that, and the other thing, right? The argument that I wanted to make, right, as a county official was totally different from this, right? I knew that a lot of people were going to be behind single payer, but I needed to convince the county officials that this was important to them, right? So I did this by looking at the county budget, right? And examining how much the county spends every month, every year on issues related to health insurance, right? The county employs about 300 or so employees throughout, all of its different operations. And so we have to provide health insurance for our employees. And it turns out that when you look at the entire year-long budget, how much the county spends, we're spending about 11% every year of our total budget on health insurance. It's just wild. The county budget, like just for comparison, we're not talking about just the personnel budget, right? Wages and benefits. No, we're talking about the entire county budget. And we pay for expensive things like all of the county roads, building and maintaining them, the plow operations, right? Running the jail, running the nursing home, right? We've got all these buildings. It's expensive. We have a big budget, and 11% of it is just on providing health insurance for our employees. Like, it's just wild. And so I presented this to the county board and they had no idea. I mean, of course we always look at the budget, but do we really appreciate, when we see $10 million a year, we're like, oh, that's 11%. That's wild, right? So just bringing them this awareness of how much we're spending on health insurance, right? And then I asked them to kind of think about it, like, okay, so we're spending all this money, we're spending $10 million a year, and are we really getting a good deal on this? And, kind of pointed out that our employees, right, are part of the same crappy system that everybody else in the public comments is just talking about, right? And, no county official wants to hear that they're wasting taxpayer dollars in an inefficient program, right? And so, yeah, I talked about how, this is wild, we're spending all this money and we're not getting a good return on our investment. And as stewards of taxpayer dollars, right, I made the argument that we as elected officials need to demand better of the county government that serves us. This really seemed to resonate with a lot of the excuse me, it seemed to resonate with a lot of the people on the board. You know, we heard afterwards that there were a lot of people who were going into the meeting thinking they were going to vote no, and they heard the speech that I made and the comments that I made, and they were persuaded, right, that this is really something that they need to be paying attention to. So, you know, there's another argument that we didn't think of, and this is important for you guys to know. Another argument for why county governments need to be paying attention to this, and how health insurance is bound up in what the county does. The way that this came about happened by accident, right? What happened is the night of the full county board meeting, right? So this was the third step where we had to get it by the full county board, all 29 of us. It just so happened that that night, the director of human services for the county was giving her annual report, right? So the director of human services gave the budget, right? She gave examples of the sort of services that they provide, right? And the services that they provide are often to people who don't have health insurance, right? And it was just this beautiful setup, because it didn't occur to us, right? It didn't occur to us to be bringing up these points and the impact that this health insurance thing has on our operations, but we were just handed this gift, and it was this beautiful lead up to what we wanted to talk about. So she got done giving her report, right? And one of the most conservative members of the county board, he raises his hand. He sits back in his chair. He's like, okay, this national health insurance thing that all these people are talking about, do you think that if it were passed, would this have an impact on your operations as the Human Services Department? And it was just beautiful and stunning. She pauses and thinks, and she says, well, it's hard to see how something like this wouldn't have a positive impact, right? She gave an example of the kind of service that she provides, which would be like, consider a person, this is a familiar story, I'm sure, to a lot of you here. Consider a person who has a mental health condition, right? And they aren't able to access the healthcare they need, right? Things escalate when one thing leads to another. And sometimes people end up in a situation, right, where they become a hazard to themselves or to others, right? And at this point, when this happens, when they become a hazard, the county's legally obligated to step in and provide services, right, in order to keep people safe. This is just what they have to do. And unfortunately, in this kind of crisis situation, the solution that the county is often faced with is involuntary hospitalization, right? And that's a solution that's not good for anybody, right? It's heartbreaking for the person, their family, and it's a horrendous waste of county resources, right? It's expensive, getting the courts involved and the hospital bills and everything. It's really expensive. And so from the perspective of being efficient with taxpayer dollars, like, it would be so much better if we could just get people the easy treatment that they need right away, right? You guys know this, get them the medication, the counseling, these cheap interventions that keep everybody healthy, so much better than, you know, finally intervening in a crisis situation. So anyway, she lays all of this out, right? And it's just beautiful. So I think that this story, you know, we got lucky that this happened, but I think that this story really convinced a lot of the county officials that were responsible for voting for this, convinced them that this is something that we as county officials really need to pay attention to, right? This isn't just some abstract national issue that people in Washington, you know, have to deal with. No, this is for us, right? We have a responsibility now to advocate for this. So yeah, the vote happened. It went on unanimously. It was unbelievable to me. Just a beautiful moment. And, you know, just one more word to talk about, like the mood in the room when this happened. After the meeting, a couple of conservative county officials came up to me afterwards, right, to thank me, and say, I agree with what you said. And thank you for saying this. Thank you for your work. This is important. And I was just floored, right? I did not expect multiple conservative county board members to say this to me. So anyway, to sort of sum all this up, right, for you guys, if you're thinking about trying to do this yourself, and I've heard from other groups that some of you are stuck at this hurdle of convincing your elected officials to put this on the ballot, right? You're stuck. These are kind of this is a strategy to keep in mind, right? You need to figure out what impact does health insurance have on your county budget, on your county operations, right? Figure that out, and then present your findings to the county officials and try to make this argument that the national health insurance issue affects county government, right? From a dollars and cents perspective. So that's what we did in Dunn County to write this referendum, right? That's what we did to get it on the ballot. Of course, that's only half of our story. We need to continue the story with John, who's gonna tell you about how we took this to the people and got their support. So I'm
Thank you. Thank you so much, Monica. That was great. And I'll now turn it over to another Dunn County Board Supervisor, who's also a woodworker and a leader in our Wisconsin Revolution, and that's John Calabrese.
Thank you, Kay. And thank you, Monica. It's great to be here, and it's great to see so many people on here. And it is quite something to hear Monica recap those moments, because they are moments that I will never forget in my life. And one thing that I would add to that, and I had some discussions even today, because it just so happened that those same committees that we brought this to, the legislative committee and executive committee, met that same day. They met today too, and they're still talking about it. And it's fascinating that it's such a big deal for so many people across the country, but people on that board, they passed it and then they just weren't really paying attention, and then started to get all this media attention, and they didn't realize what they had done. And one of the things that was important to appealing to a small local unit of government is letting them know that they are the closest unit of government to the people, and repeating that to them, because people on the Dunn County Board, we get this very small stipend for each meeting. And so nobody on that board is doing it for money. Nobody's doing it for career advancement. It's this wonderful group of people who have really inspired my ideas of what politics can be, because I don't agree with all of them politically, but they are only in it to do the work that needs to be done for the county. And so many of the people who spoke to that board, they said, we're not asking you in Dunn County to fix this problem. We're not asking the supervisors to get into your deliberations about a national health insurance program. You as a county, and this is the truth for many counties across the country, on election night, when they talk about all the counties coming in and they have those maps of all the states, the counties are the places where the ballots get printed. And so there were several moments in the deliberations where we were appealing to their nature to look at all these people who came to speak to you. Look at all these people who just want to have this conversation from August 2022 until November. They're not asking you to fix it. They just want to have this conversation. This isn't going to cost your county anything. Can you please be the representative of the people that you are and listen to your constituents and put this on the ballot so that we can have that conversation? And so that was a part of it too, in combination with all the stuff that Monica said. And we were able to get that through to them, that changing the conversation is the first step. And that's what I feel like the biggest takeaway of this whole thing is that, and that's why I think that building this across this state and to other states is a very effective thing, And I did not used to think about that, or I did not used to think that way about advisory referendums. I wanted to put my political energy into something that was binding, not binding. I wanted something that had concrete results, something that was tangible. And I thought, why are people wasting their time on this? But now I see that we live in this country. We all are doing our things that we do in our daily lives, but sometimes things in the ether, things in the zeitgeist sort of change and shift, and it just happens when you're not even paying attention to it. You can take the marijuana example that I bring up often, that also sort of convinced me that these referendum can be a beneficial thing. When I moved to California in 2003, it was the only state that had legal marijuana for medical purposes. That was 2003. That's less than 20 years ago, and now it's getting to the point where it's ubiquitous across the country, you know. And what happened? There were people who passed non-binding referenda from county to county, from state to state, to just change the way that people think about it. There are far fewer people who think that it's reefer madness insanity. It becomes part of the lore of the country. And so if we can change the conversation about health insurance to one akin to the fire department, this is the point of this. And this is how you appeal to your local units of government to put this question on the ballot. It's not really about the people in that city, in that county, changing the system. It's about changing the way people think about it. And we are that frog in the boiling water who has lived with this system our entire lives. And you get a job so that you can get the benefits and you can have the health insurance, or you don't have it and you're stressed out and you're worried, or you think you're young and in this age where you don't need it, and maybe you'll get a catastrophic health insurance plan just in case something bad happens. Maybe you can't afford it. And it's pretty fascinating that this amount of people, 320 million and growing in this country, just lives in this vicious predatory system. And so as we look at this step 3 PowerPoint, we did talk about the bottom line. And what happened was, after it passed unanimously, which surprised all of us, we had to come up with a plan how to bring it to the people. Because in a county like this, first of all, people don't know what's on the ballot. They hear the national news. Here in Western Wisconsin, they get a lot of local news that comes from the Twin Cities. And so they don't even know what's going on in this realm of Wisconsin. It's difficult. And county budgets don't have anything set aside to do public relations. They're so tight, these budgets, that you can't do that. You can't even tell people what the county actually does for them, because we don't have the finances for it. And so we thought, how can we get this message to the people? And let's start by just first and foremost letting people know that this is on their ballot, and take it from there. And so we printed up a flyer, and it had the language of the referendum on it, and it again avoided those buzz terms that Monica talked about. And it just talked about, you know, how is your health insurance? How are you feeling in this system? Do you get a sense that the health insurance companies and the pharmaceutical companies are bleeding you dry? And what we realized in that moment, and before too, is that what's fascinating about this issue, and such a good focal point, as all of you on here know, is that it's something that affects everyone. The issues are rare in this country that definitely affect everybody, no matter what your political stripes are. And to have an issue like this that should not be polarizing. And that's the message. We're trying to get to people and tell them that this should not be polarizing. Everybody ages, everybody will get sick, everybody will need this system, such as it is, or a better one, at some point in their life. And to be able to go to the doors with a flyer without the D word or the R word attached to your name really spoke to people. And we are not a huge group. We didn't have a ton of volunteers to go out there and get to every door. But what we did was we started, and like it says there, don't make assumptions about who will support this. We started at the lowest points that we could. And I don't want lowest to sound offensive, but when I ran for state office, I would make my way to the trailer park communities, and I would make my way to the apartments, even though the Democratic Party didn't always have those places in their lists of their walking lists of places to go to. And I had immense, fantastic conversations with people who didn't understand why somebody was coming to their door in the first place. And you come and you say, there is something on your ballot that I want you to know about. And I should have kept track with a tally of how many people said, I wasn't planning on voting, but maybe I will for this. Because everybody has a health insurance or a healthcare story, whether it's a story of bankruptcy, whether it's a story of ruin, whether it's a story of losing a loved one, whether it's a story of avoiding getting care and living with pain because you can't afford it, or if it's just a story of general annoyance and frustration at all the things that we have to deal with. And I would use the example of the fire department that I say all the time whenever I discuss this, and ask people what they think about the fire department. And to a person, if you ask someone, what do you think about the fire department? Just like that one sentence, they would look at you in an odd hangdog fashion, and they would say, what do you mean? I like the fire department. We need the fire department. And so that is where we want health insurance to be. It's not a partisan issue. And it's even beyond the fire department, because you can go your whole life without ever calling the fire department. But what people think about it is, we need it. We need to pay for it. I pay taxes. Yeah, I want it to go to the fire department. We want people to think about that, about health insurance. And the combination of the wording of the referendum, having myself and all sorts of other people who came up to help go to those doors and tell them that, you know what, your county board wants you to have this conversation. Your neighbors are talking about this thing that everybody is suffering about. It really spoke to people. And it became something bigger than I thought it would. And as it passed the county board, we started to reach out to the media, because our deliberations in Dunn County don't get out too far into local news. And so we took it upon ourselves to reach out to the media and kind of pitch the story and let them know that this happened unanimously. And we did a bunch of interviews, and then we tried to spread those interviews around to people. And it started to spread, and it started to grow. And it was more moving than I thought it ever was going to be, because people started to open up, and they started to tell you their stories, and they started to see the authenticity in your eyes, the general concern when you came to their door, that what if we thought of all of this differently? And sometimes those conversations went into, well, how would this be implemented? How high would my taxes go? How would this look to me and my family? But a lot of times it was people just happy that somebody was thinking about it and that somebody was listening. And it became, as everybody knows, if you remember back to November when the campaign and the midterms was going on, you couldn't avoid it, because now the ads go on your social media as well. It's not just on the televisions. It was extra vicious, and everybody knew that, and everybody was seeing that everywhere they went. And this was sort of an uplifting thing for people to have conversations about. And I did not plan on this at the beginning, but it became this moment in this movement of despite what was coming down from national media, many politicians on both sides in DC, it became a thing, just the conversations, just the caring, to sort of bridge and heal this divide that many people think the country is almost unable to get out of. There's this deep division that people are pushing, almost the politicians are pushing. They want to write off a third or a quarter or a half of the country. Don't talk to those people. Don't talk to your neighbors. And so what we saw in this when the results started to come in, after all these conversations, after all the media that we did, the interviews that we did, we went and spoke on campus to student groups. We went and spoke to any group that would have us. And we were invited by many groups to come speak on this, to come give our presentations, to come tell them why this is important, to just have the conversation. And from the moment it all began, as Monica started, when we was introduced by the people of Dunn County to the first the legislative committee, and then the full county board, and then going out to the people and speaking at the doors and talking to people everywhere. From that moment until right now, actually, or until the election results came in, there was not one single person who said to me, even the most conservative, most libertarian people on the county board, nobody said, this is ridiculous because the system we have is great, or the system we have is fine. Nobody said that, not one person. And so everybody knows that there's a problem. And it's just how deep does each person think that the problem is? How much have they and their family been affected by it? And so we get a lot of questions, and I see them in the chat as well. So what are the next steps? What can you do? What does this really mean? And it's sort of what I said at the beginning, that it's about changing the conversation. It's about showing your neighbors that you care about them. It's about helping people realize that this is something that they deserve. And there's something happening in this country. And I think in these rural areas with not as many college educated people trying to pursue the happiness that we're guaranteed in the Constitution as best they can, no matter what their income is, things are shifting. The political parties are shifting on issues. I often think of this poll I saw about the security state and about the FBI and the CIA, and just comparing it to the right and the left from the 60s to now, and how the people on the left now really trust and embrace the FBI and the CIA, but the people on the right don't. And so there's like these muddied waters in the middle that some people find troublesome or fearsome or deep with misinformation or disinformation or all these new words that everybody says all the time. But what I see is an opportunity to connect with your neighbors. And this one issue that you're all here, that you all work on all the time, is, I think, at the forefront of not only letting people know that they can and deserve to demand a national health insurance program, so that they can get out from under all the worry and the stress, but that we can come together as a people to demand of our elected officials that they actually listen to the needs of the people, which they don't do anymore. And it was just this spark that was bigger than I thought it could ever be. And when those results came in on election night, I saw the Democratic candidates running. I saw the Republican candidates running. And when they come in, it comes in from one township, one village. And I would see Ron Johnson won Elk Mound, Wisconsin, and our referendum won. Tim Michaels, the Republican running against our governor, Tony Evers, he won in Boyceville, and our referendum won. And the ones where we won were the places where we spent time, where we went and talked to people, where we handed out those flyers. Those were the places. And the outlying townships where we did not get to, they're more rural. It's tougher to get out there. We didn't have the ton of resources or time. They did not. And so what it tells me is, if the wording is right, if your authenticity is right, if you go to the people, if you talk to the people, this is an issue that everybody struggles with, that everybody suffers under. And there is a real opportunity to make this a nationwide movement to the point where it cannot be denied. And it starts with the things Monica was talking about, appealing to your local governments, and then appealing to your neighbors. And the feedback and the attention from the press, locally and nationally has shown that it is a big deal, and people are really paying attention, more than even the people on the board understand and recognize. And one of those things that is muddying the waters in terms of how the political parties are shifting is the amount of money that we can come up with the snap of a finger for the military, for war. Things are tough to get through Congress until somebody wants to have a few $1 billion for the military companies. And so in this shifting, people are saying, yeah, that's my tax dollars too. So why can't we have a health insurance system that allows for all of us to have some dignity and to live a better life? And if you can go to your friends and neighbors and you can say to them, or you don't even have to say it, but you just show them by walking up their driveway, I don't care what sign you have in your yard. I don't care what flag you have or the vulgar stickers you have on your truck. How's your health insurance? How's your health? How are your parents? Are you trying to figure out ways to look at later life care for them? And you say it with sincerity, people are going to react. People are going to want to be a part of this. And story after story after story I heard, if you just open your ears and you spend a little time, people are eager to tell you the things that they've been through. And the litany of stories is more than more than this meeting is gonna go on, and you all have heard them too. But there's one that made me feel like I was part of some serendipitous bigger thing that was much bigger than me, when I walked up a driveway of a woman in a trailer development, and she had a lovely home, and it was these unseasonably warm November days that allowed us to go here and go there as much as we could. And I was prepared to have a conversation with her, but when I got closer, I could see that she was on the phone and she was talking to somebody. And so I went slowly, and I was just going to hand her the flyer, and I heard her say, she glanced at me and she was talking to somebody who I assumed from the conversation was a family member, and she said, well, I don't know what we're going to do. The doctors say she has fluid in her stomach and they need to drain it, but then they called the insurance company and they're not going to cover that. And somebody's here. And I handed her the flyer, and and story after story like that. I didn't even talk to her, but this is how we live, and everybody knows it. And so if you can take the partisanship out of it, if you can navigate through the language and not spend so much time thinking about the process or how it's implemented, or does this language include everybody? It needs to start at the lowest level to let people know that we don't need to be the frog in the boiling water anymore. This is something that we definitely deserve. This is something that we definitely can have. And the fact that we don't is actually a vicious attack on all of us by people who are making money hand over fist off of our aging. And if you're lucky, you age. Everybody ages. And we have a system that profits off of that. And it's a conversation that, if it's said the right way and it comes with authenticity, can really open minds and open hearts. And we are now in talks with a couple other counties to try to get it on the spring ballot here in Wisconsin. It's going to be tough because state statute says that the ballots have to be set 60 days before the election, and the election is in April. The good part about that is that it's a pretty consequential state Supreme Court election, so turnout should be decent. But trying to get it through a couple county boards is, we gotta get moving now, and we are. And I'm meeting with somebody tomorrow from Douglas County, which is up north near Superior and Lake Superior and Duluth, Minnesota, and a couple other counties, and just got to push the excitement of it. You got to push the hope of it. You got to let people know what happened. And I know that the numbers in Dunn County weren't massive, 51 to 49, but it happened. And it happened in the places where we went and talked to people. Every single Republican on the ballot won, and our referendum won as well. And that's something to remember. And, you know, you do have to think of all the particulars, of course. But it's something, if you present it the right way, if you speak to the financial minds of the people in local government, if you speak to the struggles of all the people that you come into contact with, if you show them that you care, this is something that we could totally shift the conversation, and it will not become, it will move from being a partisan issue to being an issue like the fire department. And yeah, and I know that somebody is monitoring all the questions. I'd love to answer every question one by one in this slideshow, and I put that in the chat, and I'll do that again. It has all the links to every the videos of the meetings of the county board and the committees. It has some media that we've received, and I'll put that back in the chat again. But I'm not sure, Kay, how we're doing the questions, but happy to take any.
Okay, thank you so much, John and Monica, for that story. Yes, Sandy is clapping, and we want to clap because it's the kind of story that renews the hope that our country can move and do something good, and that our people at the root are not as they are often portrayed, but that there is a humanity there that if we work right, we can reach and we can use to change and make good change and to get the national publicly funded health plan that we all deserve. So thank you for doing that, and thank you for talking about it. The way we're going to do the chat is Dr. Judy Albert has been taking the questions, and she's going to pose them. And then the two of you will answer, and then we'll have the wrap up.
Okay, well, again, thank you, Monica and John. Your presentations are just amazingly inspiring, and I think everybody who's here got that, and we just need to get the word out to everyone else. So we have a lot of questions. I think it's clear, hopefully at the end of this, the first question was it a state or county referendum? We all know it was a county referendum. One of the other questions that came up early was what would have been the consequences if the referendum lost?
Okay, I guess I'll take that. I mean, okay, so it's a non-binding advisory referendum. So the officials at the federal level, they don't have to listen to it either way. What happens if it fails? It looks really bad, right? Yeah, people can pick up on that, give talking points and say, hey, we polled the people and look, they don't support this, right? So it's a real gamble. I think anybody who wants to consider doing this, you only do it if you think you're going to win. That's my take.
Do you have a thought on that, John?
Yeah, I mean, it was so close. And so if it failed 49 to 51, it still would have outperformed all the Democrats in the county by 5 or 6 percentage points. And so it's something, but it's not enough to catch the eye of the media or the attention. But it is something to build upon, and then you take it to somewhere else where you think of, do a sort of autopsy on what you think you could do better. And here, despite the fact that this is a Trump county, despite the fact that the Republicans won handily in every race, I think a big part of why it didn't do even better was time constraints. And people power constraints. And Dunn County is, it's a good 3-hour drive from Madison. It's a good 4-hour drive from Milwaukee, and a lot of the people in our group live in those areas. And if we had gotten to more people, as evidenced by the numbers that came in, then I think it would have done better. And I feel like a lot of people voted for it, not just because they understood what it means or how it will be implemented, but because people were taking the time to come to talk to them. And so, yeah, it would be a setback, but I still think that it's worth doing and worth pursuing.
I'm sure
Hey,
you learned.
can I follow up on one thing? I wanted to talk about the manpower, the resources behind our campaign. John is making it sound like it was that we didn't do a whole lot, that we didn't have very many resources. John, how many flyers did you guys hand out? How many houses did you visit?
About 10,000.
And if you had to
Gosh.
guess how many hours you spent doing that personally, what do you think?
Well, it was my full-time job for about 5-6 weeks. So, and it was more than full-time. So, I don't know. I'm not too good on math, but
Okay. So anyway, the point that I want to make is that, like, we worked really hard for this, right? It was a lot, right? And so I think that if somebody's considering doing this in their own county, make sure that you have the network and the support, the volunteers, right, to do this kind of outreach, to make sure that it's going to be successful, because it's a lot.
And to that point, Monica and John, can you estimate how many staff and volunteers? It sounds like they were all volunteers who did the work.
Well, there was staff. I'm on the staff and happen to be in Dunn County. And then there was a little bit of a social media campaign that didn't go as far as we'd hoped because for various reasons, the staff came up for 2 days and helped walk and hand out literature. There were approximately 6 to 8 different volunteers who came up and worked on it. And so there was definitely some, but
And the population numbers there, again?
45,000 people in Dunn County.
That was actually one of the questions, was how many staff and volunteers that you had. So I think you answered that. People were interested about what you think a referendum can do and what would be the next steps. You've said already about getting other referendums in other counties. Do you have any other thoughts about that?
No, yeah, it's no, yeah is a Midwestern thing that people say. They say no, yeah. We are trying to get it into a couple of counties this for the spring election, and then the next big election is obviously 2024, the presidential one, and we would like to do a proper analysis of what worked and what didn't, and try to make a big push and gain more volunteers and more members and more support for this movement, so that when that time comes, we can go forward and spread it out. And I think, like I said in my comments, it's not a thing that will, if it passes in all 72 counties in Wisconsin, it's not going to mean that every Wisconsinite has health insurance. It's about changing the conversation. It's about moving the narrative in the whole country to this thing that would be undeniable for politicians from any party. In fact, it would be something that they might want to grab onto, and the knowing that we have the finances for all these other things. So the goal and the plan going forward is to just continue these nonpartisan, face-to-face conversations with neighbors, listening to them, letting them know what is possible, reminding them that it is possible, and just taking it from there and hoping that it continues to grow.
Yeah, that's beautifully said. There were a number of questions about how you got access to your county's budget numbers, how much they were spending on healthcare. Some people wondered if you had an inside track to that because of Monica's position. And another interesting question along those lines, if you could answer it at the same time, was had you factored in healthcare for any prisoners in a county jail situation or county expenses for Medicaid?
I can take the first part of that question, and maybe I'll have John take the second part about the jail and maybe the nursing home and Medicaid. So regarding the first question, where we got the information about the budget and whether we had an inside track. So Dunn County is really great in terms of having all of its information publicly accessible on the web, right? You just go to the Dunn County, Wisconsin website and it's all there. It is so well organized. It is brilliant. It's one of the greatest things about our county government. So it's just there. That's not the case, right? For a lot of places. For you all, I'm imagining it would be more difficult. So it's all public records. What you can do is, I would say, probably contact your county clerk, or there's probably some similar position, and ask them for that information. They're legally obligated to give it to you.
Other thoughts, John?
Yeah, that's public information. And then as far as the jails go, I don't think it was part of our consideration at the beginning, just because the numbers were so stark for just the general health insurance that, you know, when we had this idea, I had seen people, and this is why one of the main reasons we decided to bring it to the counties was that my experience in the county government rejuvenated my my hope about what government can be, because the state stipulations and mandates that they put on county are such that you just have to spend time trying your best to provide the services that the people expect. And what I would see, I know you mentioned the Medicaid, was people that I know were conservative, for certain, start to look at the numbers that were put before them and say, wait a minute, okay, so the fact is, if Wisconsin took the Medicaid expansion, then the reimbursement rates for all the people, not all the people, but most of the people in the county nursing home would be this much greater. So we wouldn't have to cut costs there. So we wouldn't have to let people go. We wouldn't have to close down the cafe there, or all the decisions that we have to make. And I would see conservative people not only change their positions, the positions that have been right or left, but then they themselves presenting to our state lawmakers at our annual legislative agenda meeting, saying, hey, take the damn Medicaid expansion. What are you doing? Like you, and so that was the focus on the numbers. But even then, we hadn't considered the stuff that the Health and Human Services reported on their annual meeting that Monica mentioned, or the cost to the jail as concerns healthcare costs to inmates, and that is an additional cost, and the $500,000 a month that Dunn County spends on health insurance for employees, that doesn't include the administrative costs of the people who work in that department, who spend the whole year researching and looking for a better plan, implementing it, dealing with the requests and the questions and concerns from the employees, helping them navigate the system. I mean, it's even more than the 11%. And so, no, we did not consider it at the beginning, but we have learned to consider it now. And it's definitely something to present to county boards and municipalities if and when anybody wants to do that.
Yeah, we've started looking in our county here, and the county counselors who are part-time paid employees have openly stated that there's no transparency and they never know how much they're spending on healthcare. So we have a big job ahead of us trying to sort that out. One of the themes was, how did you convince conservatives? What kind of objections did perhaps more conservative voters give? And how would you respond? And one of the people from Humboldt County, I think it was, stated that in their campaign, what they heard most was, I worked all my life for my insurance and Medicare. I don't want someone who doesn't work to get what I worked for. So wondering if you heard those kinds of comments.
You know, I personally did not hear many of those comments, and I know that I'm certain that some were spoken online and among like-minded people without me being present. I did get some people saying that sounds like socialism and I'm not going to do it. And the most pushback I got was right nearing election day, and which led me to believe that there was some sort of campaign against it that was maybe sent out in Republican email lists or somewhere, because at the beginning nobody really knew about it, and so I did not get that specific comment, but I did get comments of people saying that, you know, this sounds like socialism and my taxes are going to go up. But if I did get that comment, you know, I think I would just try to appeal to someone's better nature and say, but would it make you angry that someone wouldn't have to deal with the stress and burden of this situation and still be a productive member of society and still pay into this system? And what you mentioned is a similar argument to student debt relief, and how people say, you know, I paid off all my student debts, why should these other people not? And what it is embracing and being a part of a system that is not good. And, you know, there are many ways that you could combat that. But it's in my mind, it's always with an eye towards things change, and that's the only constant in life, is that things change. And it's, you know, when the engine came, when cars came about, and someone says, I had to ride in a horse and buggy, you know, it's things change.
You did too.
And
I
so
have I'm sorry, I didn't mean to.
no, go ahead.
I was going to add a couple of arguments that came to mind, responses to common conservative objections. So the one that comes to mind is the fire department, which John mentioned. You can leverage that example in a lot of different ways. Like, oh no, this sounds like socialism. Well, like, what about the fire department, right? Is that socialism? And then also on the subject of like, oh, well, I don't want people getting the benefits if they didn't pay for it. You know, I worked hard, and, you know, those type of concerns. Well, again, like, think about the fire department, right? So if somebody isn't paying their taxes, like they're behind in taxes or whatever, right? Are you gonna let their house burn down? No, I mean, it's bad for the entire community, right? To let houses burn down. The fire protection extends to everybody, because that's, well, I think probably because you ought to do that, but also if you're looking at a conservative, just, you know, it's in everybody's interest, right? And so if somebody gets sick and starts needing county resources, right, that I described, you know, that affects you too. So.
Along the lines of conservative pushback, somebody asked if you got noticed enough for big money to come out against you. And they also were wondering what your budget was and whether you know what might have been spent against the referendum.
We did not get enough attention to receive any significant noticeable pushback. That's not to say that it didn't happen. You know, one of the things, and I'll get back to the question, was that the Democratic Party of Dunn County, the Dunn County Democrats, they kind of grabbed it, and I was surprised, because I know many of the people on that board and people who are involved with them, and there are some old guard Democrats who might not agree with a thing like this. And in fact, our president now said during the campaign that if Medicare for All came across his desk, he'd veto it. Speaker Pelosi wouldn't bring it to the floor for a vote. So there was no guarantee that the Democrats were in favor of this, but just through some connections and some people we had, a friend of mine is the chair of the Dunn County Democrats, and he said we want it. They put it in their literature, they put it in their flyers and door hangers. They had us come speak to their group. And in retrospect, one of the things that we are deliberating as we go forward as a group is that a good thing? Is that something that we want to pursue? It was such a whirlwind that we were thinking, well, geez, it's a pretty split county. If we get the Democrats on board, then maybe, we can at least lock up that many people, and then we can take it from there. But we don't know if that's the right thing, because if the Democrats make it a thing, let's say that the Dunn County Democratic Party urges you to vote yes on referendum 1, then it necessarily becomes something that the Republican Party are against, no matter how it's worded, no matter how many people that you go to. So that was something that we talked about, but we did not get enough attention to get any significant pushback or money spent against it in ads or anything else. And was there another part to that question?
What budget? What kind of budget did you have?
We sent out 4,000 mailers and tried to get those to people in places that we did not get to with our feet. And that cost about $1,500. The 10,000 flyers cost only about $600. So there's $2,000, and then staff time was probably another $3,000 to $5,000. And so under $10,000, and more could have been spent on staff time if and it was there. Not a huge budget, but there was some.
I'm sorry, could I ask a quick question related to something you already spoke about?
Sure, go ahead.
Okay, I was wondering about determining the budget, the county budget, and how much is going toward healthcare, how you got it. Would that be related to wages versus medical benefits? Would that be the comparison?
Yeah, so when we looked at the spreadsheets, it was broken down like line by line. And there was a line that, just was specifically health insurance. Does it answer your question?
Yeah, but I think I can go a little bit deeper with my county to find out if medical benefits is it. Also, you said it was 11%, whereas our county right now looks like they're spending about 26% on medical benefits versus wages. So that's a good number as long as it's legitimate. That's in the proposed budget for 2023. Also, you said your county spent about 11%. How would you then compare it to what they would be spending if you had a national system? Did you have a percentage number?
I don't know the answer to that. Maybe John does, but I just wanted to point out one more resource of people you could ask as you're trying to figure all these numbers out. You could just call up the head of the Human Resources Department, right? The head of HR. And yeah, I did that in my department, and they had a lot to say. They're very happy to talk.
Yeah, it's hard to say what the county itself would be spending on health insurance or programs for its employees, or incentives for them to be healthier, to encouraging them to take part in whatever program this manifested itself in. But there were some interesting proposals from a former board member and some other people about that. If this ever comes to fruition, it would stand to reason, if you look at other countries around the world, that, and just the basics of it, that every American's taxes would go up, all the employees, all the people who work for the county. And so as you try to attract employees to be county workers, then you could maybe look at the money that the county has saved through this system and offer that as an incentive to offset the costs of increased taxes on their employees. And so I think that there is a stress and an importance to trying to figure out how this is implemented, trying to figure out the exact numbers that counties would save, the exact numbers of how much taxes would go up. But to me, it's exciting to think of the different ways and the different formulas to make this work, so that county governments, municipalities, school districts don't have this massive burden of the time and energy, and that the people just understand it as something that is granted to them as being a tax-paying citizen of the county or of the country. And I'm not trying to dismiss your question. These are all interesting topics for me, and things that you should have answers for when people ask you, because that's how the conversation shifts. But the bigger picture in my mind is letting people have that conversation and ask those questions to imagine what it would be like, and then demanding of their elected officials that we remove this vicious middleman that's crushing all of us.
Yeah, and it was pointed out in some of the comments that a single payer makes small businesses more attractive for employees, or makes it more attractive for small businesses to start up, because they don't have to compete in the same way to get health insurance for their employees. A larger corporation has much more leverage with their economies of scale, and it would help larger corporations as well, because they wouldn't be paying these ridiculous amounts in health insurance. So there are lots of ways to work that. And you're right, we need to have lots of different ways that we can answer it. There was a question about what you might think about a referendum for a state single payer system, I'm assuming is what the questioner meant by that, rather than a federal plan. I don't know if you guys have thoughts on that.
Yeah, we've talked about that, and I think we have some history to go on about why that was not the route we took, why that was not something that we were calling for. I know that Vermont passed something some years back and it did not work. I know California attempted it recently, and just a massive amount of pushback and money that poured into those states to defeat it by the industry that we're sort of fighting against was so massive that I don't think even California, the state that would be I think 5th largest economy in the world if it was its own country, got such pushback that it did not pass there in a very liberal Democrat controlled legislature, that if you're just an outlying state, you are ripe for attack from the very industry that we're fighting against. And just based on history, it seems almost impossible, even if it was a good plan, even if you had the money as a state to implement it, that it wouldn't be attacked and taken apart piece by piece by the industry that did not want that to spread to other states.
I mean, I think those are great examples, Vermont and California, and it's not the first time that California's tried. And so I think it's important for all of us to have an analysis of that as well. Somebody wanted to know if you had any idea yet as to the age and other demographics of the supporters of the referendum.
We did not have those numbers. It's tough to get those from just the election results, and so no, we don't have those numbers.
And also, what was the follow-up reaction or discussion by conservative leaders in the county after the election? I think you said it was still topic of conversation. I'm not sure if I heard what the reactions were.
Well, it's do you want to say something, Monica?
Nothing super important.
Okay.
I was going to ask that everybody mute their mic, but it looks like somebody just did mute their mic because I was hearing that echo. I don't know about you, John, but I haven't heard anything from any conservative leaders on this topic. What have you been hearing?
It's a different world inside the county board, and I remember the board meeting, I think the full county board meeting after the election was 1 week later, and there were people who, you know, congratulated me, and some that just, that when you are immersed in local government and you see things in a nuts and bolts way, just straightforward words. There were 2 people who said to me, I can't believe it didn't pass by more. And then there was another person who said the same thing, who is not a conservative. He's like, I just don't understand. How can people look at that question and not vote for it? And so it was, I had those few comments, but then I had a lot of congratulations to me, whether people supported it or not. And I think, like I said earlier, not just appealing to the board's status as the closest unit of government to the people, like they like to get some recognition for things that they're doing. And so they saw the media and they saw the press, and they felt proud to a person. I didn't have one county board member tell me that I was crazy or that this is ridiculous or anything. It's just it's this point of pride, and I don't know for certain that it's this way in other counties and other municipalities. In fact, I know for certain that it is not this way in many others. But people who do this work not for financial gain, they kind of like watching it play out. And so I didn't get a ton of pushback or anything. And the only pushback from putting it on the ballot that was significant at the onset was, is this under the purview of the county? Why are we talking about this? Why, when we have all these things to do, are we having this discussion? And that's the key point, when you have to convince them that, using their county numbers and their status as close government officials, that it's important to let the people have this conversation.
So we're getting very close to the end. I just wanted to throw one more question out that was actually Kay's question. Did anyone say that this was too big of a step, that you should lower the goal to something smaller that's more possible?
Well, like I said about the state programs, it's a question that I think, and no offense to who asked it, in fact, I've asked it myself before. It's a question that's couched in the living in the system that we all live in, and it's like what I look at it as, it is a small step, because it's just one little county in a state of 72. And I was on a call the other day with Texas single payer folks. They got 253 counties. So it is a small step, but it's talking about a thing that will take care of everybody in the richest country that the face of the earth has ever seen. And we need to be done with half measures. We need to be done with tweaking around the edges. We need to let everybody know that this needs to be the thing. We can afford it. We can manage it. We went to the moon. We invented the airplane. We invented blues and baseball and all the things that America, appealing to the patriotic nature of people is there's no more time for half measures. It's the fierce urgency of now argument as well that you got to deliver to the people. And we thought that if we were going to take this, you might as well do the thing that would remedy the problems that we have for everybody.
Absolutely, the right answer all the way through, John. So we're going to end it there. Thank you, everybody, for staying on the call and throwing in your questions. And I'm going to pass it back to Kay. You can see in the chat how you can take action. So Kay, you want to wind it up?
Well, I'm grateful to John and to Monica for what has to be an uplifting story for everyone with all that we face, to hear the story of how the people at the grassroots of our country are for this, and that if we can make democracy work, we ought to be able to pass this national solution, and it's just up to us to figure out how to organize it. And perhaps they have touched on one of the ways that that can be done. We have to give people the hope that we can do it, because when people say you can't do it, they sometimes change the goal and back off to setting lower standards. And if this is the national program that will work, getting the profits out of our healthcare and covering everyone, then that's what we have to fight for. And they've found a way to do it. National Single Payer hopes to be able to convene a meeting between some of the people who've done this. I know Dr. Pam Gronemeyer has done referendums in Illinois, and her experience was that she got huge 60 and 80% votes for them. And so it is one way to work and to move. And if we can develop it, we'd like to do that. So we hope to be able to get together with people again at some point and to see if we can talk about a way to move it forward. Thanks to all of you for coming. And if you want to get in touch with National Single Payer or make a donation, it's there in the chat. And thank you for attending.
Thank you, everybody. It was great to be here.
Good night. Thank you, everybody.